Hello, this is Alejandro Navarro with Chapter 10 presentation for healthcare economics, and the chapter focuses on market for pharmaceuticals PowerPoint. Structure of the industry. There are two types of research for pharmaceutical: applied research and basic research. Applied research is research based on the commercialization or advertisement of these types of products or medication or drugs or whatever you want to call them. Basic research is research to advance essential knowledge, so just regular old research, which is trying to find out what new combinations we can create a more effective type of medication or whatnot. The U.S. relies on private sector and market mechanisms to influence research and development. The role of research within today's technology age. The industry mostly relies on research and development to locate and construct new chemical compounds. From 1940 to 1990, 60% of these drugs were developed within the United States by U.S. firms. 45% of the drugs from 1975 to 1994 were also developed within the United States. The longer that a drug or medication is on the market, the lower its return on sales, the financial quantity of a firm's ability to generate after-tax earnings out of its complete sale. Okay, the R&D process. The profit potential for thriving new drugs are high. However, the likelihoods of getting a new chemical or drug or compound or whatever you want to call it is very minimal, very, very low. The average rate of approval is 12 to 15 years, which is like a decade. Like over a decade and a half maybe. The steps in pharmaceutical R&D are discovery, preclinical, 3 phases of clinical trials, and FDA review and approval, post-marketing testing phase 4, which I think is maybe how the public reacts to it. Maybe I'm not sure about that one. I'm not sure about the discovery and preclinical. I think that's like when it's first created, and then they put it on, test it out on maybe animals or something. Okay, policy toward innovation. The U.S. patent system emerged as colonizers in the New World recognized that rewarding distinctive innovation would benefit society as a whole. The U.S. Patent Office was authorized during 1836 to determine if these inventions were worthy of the patents. Regulation of any types of drugs became the responsible of the Food and Drug Administration to make sure they're safe for all. But like everything has pros and cons, so depends on how we react to them. The goal of the patent system is to ensure acceptable records for research and development consistent with the products and its information. However, there are 4 flaws with this patent system. These patents create monopoly payments, so that means they're like one of a kind. So it's like Toys R Us during the 90s when it was really big. It was like the other one around. The second big flaw, it fails to account the valuable superficies. I'm not sure what superficies mean. Let me check real quick. It's superficies are. So it's outward appearance, I think. That's what it means. Superficies of light, the outward part of light. Oh, third one, patents don't transfer to the proprietor. Oversupply, and finally it don't transfer to the society oversupply. So it doesn't. It's not transferring, I think, to anyone that's benefiting from this. Finally, the theft of a cotton gin, which was created by Eli Whitney, shows others that these patents offered diminutive defense against thefts. Let me see. What's an example that I could tell you about the last one? Oh yeah, when McDonald's was first found, if you saw the movie The Founder, uh, John Kroc or whatever his name was, came and stole everything, even though they signed a contract with the McDonald's brothers and everything. So even though these guys had a patent together, and then stopped Mr. Kroc's, Ray Kroc's greed of patents on drug prices. The fancy conduct of academic assets through the patent distorts drug systems. It limits treatment options for those who cannot pay. So if you cannot pay, you cannot pay. End of story. They won't help you. The awarding of a patent provides like I said earlier, provides the innovator with monopoly power. So basically, when it comes to that specific drug, they're the big cheese. They're the top of the game, top of the stars. Creating a prescription drug insurance plan with a co-payment provision invites monopolist response. And the drug expenditures fell from 56.8% to 17.8% in the time span of 1990 to 2012. So a little over 20 years. Okay, so advertising and promotion, like every single product in the world, whether it's a toy, a new car, or like something from IKEA, it has to be advertised and promoted. Pharmaceutical companies have quickly learned power of marketing. This industry spends up to 27 million on marketing and promotion since 2010, and that is a lot, just on one promoting the product alone. Jeez. Wow. DTC advertising reached 791 million in 1996, and it jumped to 4.8 billion in 2006. This is 40% of the industry money, I believe, used on promotion and advertisement alone. That's almost half. Almost half. That's a lot. Okay, so international issues. There's not just going to be problems here in the United States with these products or drugs. There's going to be problems across, like in Germany, Uganda, let me see what else, Ecuador, let me see, what's another, Malaysia, any country you can think of, rich or poor. Supporting pharmaceutical R&D requires incentives that reach beyond the borders of a single country. So one country cannot handle all that responsibility and research and development, trying to find out how it works. The cost of R&D is a quasi-fixed cost, no matter how many folks or countries have access to these drugs. So quasi-fixed means semi-fixed, like partially, like maybe a house payment, but a bit varied per month. The most direct way to cover global joint costs to allow patent holders to discharge dissimilar prices and different prices. And these are the negative qualities of research R&D. If you want, okay, I got one more slide for you, which is a discussion question. If you want, you could either read the book, and if it's a bit too technical, fancy, you could probably go online or ask our professor. Okay, so the DQ for chapter 10 that I provided is, do you think 12 to 15 years is too long for approval of the FDA drug or medication. And that is my presentation. My name is Alejandro Navarro, and thank you.